Good afternoon. This is Anita with the Health Department. On Sunday, April the 19th, it was announced that Lewis County had another positive COVID-19 case. That was incorrect. That person was a resident of Lewis County, but has not been in the county for over 2 years. However, today, on April 22nd, Lewis County was given notice of another positive COVID-19 case, and that does bring us up to 3. Currently, the local health department nurse is working, doing contact investigation. So I want to talk to you a little bit about contact investigation. That is something the health department does all the time, and we use that jargon, just like you all have jargon for your own professions that nobody knows what you're talking about. So I just want to talk a little bit about contact investigation and what that means and what that looks like. So if you got the word, if you were diagnosed with COVID, that's what I'm going to talk about, because that's what's on everybody's mind right now is this COVID-19, and you got that diagnosis from your physician or from the health department, you got that result. What that means is that we would do some contact investigation, of course. We'd give you a call. We would reach out to you, and we would ask a lot of questions. It's an in-depth questions. We would begin with things like, how are you feeling? When did you notice when you began to get sick? When was your first symptom? And we would lead through that investigation or that interview, and we would want you to think of things that maybe you didn't realize, gosh, I didn't even recognize that was a symptom. Or we would clue you to think of maybe something you forgot. So it is an in-depth process, this contact investigation. It may even take more than one call, and we may even have to consult with the state health department, depending on what your circumstances is and where you've been and who you've been with and those type of things and what your occupation is. So once we get all of that and we compile that information, we're going to calculate things like infectious period. When were you the most infectious, and who were you in contact with at that time? And then that will lead us to some other things that may obviously the person that's positive, they're going to be in quarantine, but that may lead us to quarantine other folks, or it may lead us to have folks do self-isolation. It may lead to even further testing of people. So this contact investigation, that's a very important part of this COVID-19. While I want to talk about my health department staff with that for a little bit, like I say, we've done that. We do that all the time. Typically, we have one nurse that does that. And that is what she does. She is an expert with that. She goes to the training with that. And when this all hit, we realized, gosh, we've got to do more training. We're going to have to train our other public health nurses. And they have been absolutely fantastic. I'm so proud to be their director of the Lewis County Public Health Department. Those nurses and the other staff, they call me all the time and say things like, what do you need? What can I do to help? They've been absolutely wonderful. So once we get all of that information and we determine who we need to contact for you, that's what we'll do. And we're going to stay in contact with you. We're not just going to leave you. We're not going to say you have to stay in there for 14 days and not be in touch. We'll be in touch with you daily. So I know this is no fun and this is hard, and I know we are beginning to talk about opening up the state and opening up the country, and that scares me just a little bit, because last week, I talked about how good I saw everybody behaving, and they were doing all the great things. They were wearing the mask when they went out. They were staying the 6 feet apart, and I don't know if because it's so pretty or if because we're kind of starting about talking about opening up the the state and the country and what that will look like, because now I've noticed we're not doing as well as we were. But I want you to keep in mind that when the president and the governor talked about opening up our state and the country, they gave pretty strict guidance on how to do that. And one of the very first guidance is we have to have a negative or a drop in cases for 14 days. So we're not there. We're not there. This is not the time to start slacking off or think, oh, this is going to be over with soon, because we're talking about opening up. And yes, that is exciting, and I know people are so tired. I know people have lost their jobs because of this COVID-19. I know that, as I said, I haven't seen my grandbabies, and I just want to see them so bad. There are folks that haven't seen their parents or their grandparents. That would be so hard to deal with. My mother was at the facility here locally, and when I first thought of that, I thought, well, I would have just took her home. I would have just taken her home and kept her with me. But then after I realized, well, what would I have done? Kept my siblings from seeing her? Because she would have had to have still been isolated. So that really wouldn't have been the answer. This is really not the time to be slacking off or thinking, I don't have to worry about COVID-19 as much. Because there's a couple of those sayings that come to mind, and one is cutting your nose off to spite your face, or shooting yourself in the foot. Please, we are doing such a good job about trying to flattening that curve, and we don't want to do anything that would undermine that. If we do it too soon, this fall, we're going to be looking at a rebirth of this COVID-19 on top of the flu. So we definitely don't want to do that. And I know you all don't want to do that as well. Nobody wants to go through this any longer or any more than what we have to. So I still urge you to be very, very aware that COVID is here, and we still need to do all of those things about social distancing, wearing masks, one person going into the store per family, getting your stuff, getting out of there, washing your hands, scrubbing the surfaces, all of those things, all those guidance that CDC has asked us to do. And the big one is social distancing. Please do not get relaxed with this, because again, as the old saying goes, we certainly don't want to cut our nose off to spite our face. If there is anything that the health department could do, if you have any questions, anything that we could answer, please don't hesitate to call us. We'll be glad to help you in any way that we can. Again, stay home, stay safe, and God bless.